Welcome back to the channel. Thanks for joining here at Unapologetic Progressive. Today we're going to continue going through that article discussing the COVID-19 vaccination recommendation changes that RFK Jr. made. And I don't know how long this video will go, but I'm going to talk about the rest of this article. Then we're going to talk about my own opinions on a lot of the stuff that we've been talking about over the last few videos. But let's get started. Now, if you remember, we left off right here. What's the process for changing vaccine recommendations? It says changes to the vaccine schedule are typically made after federal officials solicit recommendations from two panels of experts in infectious disease, pediatrics, and other relevant specialties. The head of the Centers for Disease Control and Prevention and the Food and Drug Administration then review those decisions through their respective panels and issue a joint recommendation. Kennedy's decision breaks with this practice. According to Stockwell, who was the person we were just getting some quotes for earlier in the article, it can be confusing to families, particularly when there's conflicting information about vaccination. The American Academy of Pediatrics also raised concern about Kennedy's disregard for the normal procedure of changing vaccine recommendations. In his brief comments on social media on May 27th, he didn't mention consulting any doctors or panels. This decision bypasses long-established evidence-based process used to ensure vaccine safety and ignore the expertise of independent medical experts, according to members of the CDC committees who are examining evidence regarding the vaccine to make recommendations this fall. Dr. Sean O'Leary, chair of American Academy of Pediatrics Committee on Infectious Disease, said in a statement, by removing the recommendations, the decision could strip families of their choice, those who want to get vaccinated but no longer are able to, as the implications for insurance coverage remain unclear. In the wake of Kennedy's statement, the Infectious Disease Society of America urged insurers to continue to cover the COVID-19 vaccine for everyone, including the group Kennedy said the government would no longer recommend the vaccine for. The ISDA strongly urges insurers to maintain coverage for the COVID-19 vaccine so that all Americans can make the best decisions to protect themselves and their families against severe illness, hospitalization, and death. Society President Dr. Tina Tan said in a statement. Went on to say, IDSA also urges Congress to conduct meaningful and necessary oversight to ensure appropriate decision-making process at the Department of Health and Human Services, which will impact people of all ages. Is this what RFK Jr. said he would do? Months ago, in the lead-up to his confirmation, Kennedy told at least one senator that he would follow CDC guidance and advisory committee recommendations about vaccines. Now, these are things he said during his nomination hearings. Senator Bill Cassidy, Louisiana Republican and physician, said Kennedy assured him he would adhere to expert guidance on vaccinations. He spoke from the floor of the Senate in support of Kennedy, explaining to his colleagues that Kennedy also committed that he would work within the current vaccine approval and safety monitoring systems and not establish parallel systems. If confirmed, Cassidy told them, he will maintain the Center for Disease Control and Prevention's Advisory Committee on Immunization Practices without changes. And there's the problem, right? There's the rub, right? He lied. Because not only did he tell this senator that, right? He told people that he would do the same thing during his Senate hearing, his confirmation hearings. that he would follow the guidance that's already there, or not the guidance necessarily, but follow the process for any changes to vaccine recommendations. He didn't do that here. Once again, this is just a person making bogus claims with no scientific backup at all to make his claims. As we discussed in the last video and earlier in this article, vaccines, especially the COVID vaccine, has been seen to be widely effective and safe for children, pregnant women, and everybody else in between. But here's where my opinion comes in. Because up to this point, I've just basically given you what this says and a little bit of my own, opinion along the way. But this is strictly my opinion. I believe that the choice to vaccinate with the COVID vaccine or not should be up to you as a human being, you as a parent, and you as an individual. Now, I completely understand that at this particular point in time, the COVID vaccine is not necessarily necessary for every single person, although I recommend it myself. But I believe it should be something that should be left up to us as individuals and for parents to choose whether or not to vaccinate their kids. But here's here's a little factoid about vaccines. The more people that have them, the fewer people get sick and the fewer people die of COVID-19. This is obvious. This isn't something new. This is how vaccines work. Because fewer people get sick, and those that do get sick that are vaccinated likely have less negative outcomes. It's just like the flu shot. You get a flu shot, you may still get the flu, but you're less likely to die from the flu. Now, there's all sorts of reasons why vaccines don't work at times. For example, the seasonal flu vaccine that you see every year. Some years they pick the wrong formulation. Some years the viruses that they see that they think are going to be the dominant strains of the flu are not the ones that turn out to be the dominant strains of the flu. I remember, what was that year? I think it was 2013, 2014, somewhere in one of those 2 years, where the flu shot turned out to be roughly garbage. Roughly 30%, it had 30% protection for where it needed to be. Right? It had 30% when they were looking closer, thinking closer to 90. Some mistakes happen. Things happen to where the vaccine doesn't work as well. But you know what? I got the flu that year. And I got through the flu that year because of that vaccine. And the fact is, vaccines are safe and effective for most people. Now, if you have a history of ill effects, then no, don't get a COVID vaccine. Especially if that was if the effect was so bad that it was life threatening. Now, if your ill effect was, oh, I have a sore arm for a week or two, that's not such a big deal, right? But if you have, um, the different syndromes that can come about from some vaccines, then sure, don't take it. If you had an anaphylactic reaction, don't take it. But if those aren't your lived experiences, right? If you're not dealing with those, you don't have a history of that, you don't have a family history of issues like that with vaccines, I suggest taking it, especially if you have young children or if you are around elderly people or people who are immunocompromised. Now, these are just my opinions. These are my recommendations for people. That's not a demand, but it's just my suggestion. Like, if you can get a flu vaccine, get the flu vaccine. If you can take a COVID vaccine, take a COVID vaccine. If you're at 50 years old and you need a shingles vaccine, go get that. Now, you can choose not to. That's your choice. As an American, you should be free to make that choice. But the one thing I'm going to say is don't come crying to me when those COVID numbers start spiking because people can't get their vaccines and we're back where we were to where they're having to shut things down. There's currently a new variant of COVID-19 that has killed 350 people a week for the last month. Now, that may not sound like a whole lot, right? 350 people dying of COVID once a week or every week. That may not sound like a lot. And compared to where it was and to other causes, no, it may not be. But it also protects you against long COVID, as we've discussed in this article and other things we've discussed. And I hope that you feel that I've been consistent on my messaging throughout the entirety of this pandemic. Things changed though, right? Early on, the one thing that I would say that was different in my viewpoint was that I believed everyone should have to get vaccinated when the COVID vaccine first came out. Not because I was some, control freak or something telling other people what to do, but the prevailing wisdom then and still now is that the more people that are vaccinated, the less likely people like me are at risk. I also have several friends who were going through cancer treatment when those vaccines came out, and without those vaccines, their family members couldn't have come see them because many of them didn't have immune systems. So it wasn't safe for them to be around people, especially people that could potentially have the virus, right? So it's not my decision to make at this point, right? The difference now is that COVID-19 is not killing as many people as it was back in 2021 when those vaccines came about, right? But now things have calmed down a bit, and COVID-19 is not as big of a deal for most people as it was, but it is still out there. So for this man to go off thinking that it's unnecessary for people under the age of 65 who just happen to seem healthy, right? To say they just can't have the vaccine or there's going to or make changes to where insurance is no longer cover it is putting blood on his hands. Now, like was said in the article, if they did research, if there was actual scientific research that was done to say that the COVID vaccine was dangerous, which there has been no study that has shown that, then maybe. But that's not the case. This wasn't done on a scientific method. This wasn't done by any scientific basis at all. Anyhow, thanks for watching. I'll see you down the road.